More businesses are reopening. We talked about nail salons. The more people are resuming activities, the experts say the numbers of COVID-19 cases will continue to rise. Governor Newsom issued the mask mandate yesterday.
But are people getting too complacent? Dr. Nicholas Testa, Chief Medical Officer with Dignity Health Southern California, joins us now to discuss this. Good morning, and thanks for being here.
Good morning.
We are seeing numbers steadily go up. Can you explain that?
Yeah, so we've seen a rise in 18 states. And if you look at the numbers in Los Angeles County, I look at the numbers together with Long Beach, we're seeing 2,000 new cases on some days. So we're not seeing it go down. And I think you can directly connect that to the relaxation of the social distancing measures. I don't think that's necessarily people becoming complacent. We are doing what we said we were going to do. We're getting into this next phase. What's key is that we don't see a huge spike. We don't want to get to 5,000, 6,000, 7,000 new cases a day. So this was sort of anticipated as we started to relax the social distancing measures.
Now, some people will say more cases because of more testing, but that's not necessarily how hospitals are looking at it, because they're saying, the hospitalization numbers are continuing to go up. So do you feel hospitals are ready for COVID and non-COVID patients?
Yeah, we're a lot more ready than we were 4 months ago. We've talked about this before, through the stay-at-home order and the sacrifices that everybody out there has made, you've bought our hospitals times to get prepared. And we really have. Our hospitals are managing COVID better than they ever have, as is every healthcare provider. So, just to give you some examples, our ability to transfer patients between hospitals when we're getting tight on ICU beds is like nothing I've ever seen before, at least within our own Dignity Health system. And then if you look at our SNF partners, our skilled nursing facilities, where a lot of patients are discharged to, particularly our sicker ones, more and more SNFs, which have been very scared about taking these COVID patients, are taking them because they're more equipped for them. And that allows the throughput in hospitals really to improve. And finally, we're just getting better at treating the COVID patient. What we're doing today around ventilator management and available medications is totally different than what we were doing 4 months ago.
Wow. So we've been hearing about an inexpensive steroid. There was a recent study that came out that can help in the treatment of coronavirus. Can you tell us about that?
Sure. So what we're talking about is dexamethasone. It's a very commonly used steroid. It's been around for a long time. And the study came out of Oxford. And what it showed was that for patients with severe disease who were intubated, there was about a 1/3 decrease in death. For patients who are oxygen dependent, there was about a 1/5 decrease in deaths. Great numbers, very positive, and really suggestive of good outcomes. But where I want to caution everybody is twofold. One is that this is not a drug that's meant for the outpatient setting. So we don't want to see what happened with hydroxychloroquine. Remember, right? People were running out, hoarding hydroxychloroquine. Right. This is not a drug for mild symptoms, right? This is for somebody who is hospitalized, who is oxygen dependent. The second thing which we all have to realize is there's a real risk when we have information and data being released through media channels without the peer review information coming out in the scientific literature. And that's where we're at right now. So the data on dexamethasone is positive, but so was the data on hydroxychloroquine, so is the data about some of those vaccines that have come out. But what's happening is they're getting released very prematurely through channels like the media, and where they really need to be scrutinized is what's happening right now. Is the data was just released to the World Health Organization, and now we'll get a group of scientists who will really look at it and pick it apart and say, are these results really what we want to see?
Right. Okay. A lot to think about. Thank you so much for joining us this morning, Dr. Testa.
Thanks, guys. Appreciate it.